What if the number you've been told to watch for years isn't the most important one for your heart? Most people believe that cholesterol is the main thing that determines heart attack risk. You get your report, you look at your cholesterol levels, and if they seem normal, you feel reassured. But here's something many people don't realize. A large number of heart attacks happen in people whose cholesterol levels were considered normal. That means something else is being missed. And this is where things become important, because your body often gives early warning signs long before a serious event like a heart attack happens. The problem is, those signs are not always found in the standard tests people rely on. Over time, the understanding of heart health has changed. Doctors and researchers have found that inflammation, hidden damage inside blood vessels, and how your body responds to stress can all play a major role in heart disease. And these factors are not always reflected in basic cholesterol numbers. So you might think you're safe, while something more serious is slowly developing underneath. Now, this is not about creating fear. It's about awareness. Because when you understand what actually matters, you can take better control of your health. In this video, Dr. Nathan Collaway explains 3 specific blood tests that can reveal heart attack risk more accurately than cholesterol alone. These tests look deeper into what is happening inside your body. They can show early signs of inflammation, stress on your cardiovascular system, and changes that may not be obvious otherwise. And the most important part is this: these are not complicated or rare tests. They are available, they are measurable, and they can provide valuable insight into your long-term heart health. If you've ever checked your cholesterol and assumed everything was fine, this is something you need to understand, because sometimes the numbers we focus on the most are not the ones that matter the most. And once you see what these tests reveal, you may start looking at your health in a very different way. Let's start by understanding why cholesterol alone is not always enough to assess your true heart attack risk. For many years, cholesterol has been treated as the primary marker of heart health. People are told to lower their cholesterol levels, and they are often reassured when those numbers come back within a normal range. And while cholesterol does play a role in heart disease, it is only one part of a much larger picture. The problem is that heart disease does not develop from a single factor. It is usually the result of multiple processes happening inside the body over time. One of the most important of these processes is inflammation. Inflammation is the body's natural response to injury or stress. In small amounts, it is helpful and necessary. But when it becomes chronic, it can begin to damage the inner lining of your blood vessels. This damage makes it easier for plaque to build up and for blockages to form. And this can happen even if your cholesterol levels are not extremely high. This is why some people with normal cholesterol still experience heart attacks, because the underlying issue was not just cholesterol. It was ongoing inflammation that went unnoticed. Now this brings us to the first blood test you need to understand. It is called high-sensitivity C-reactive protein, often referred to as hsCRP. This test measures the level of inflammation in your body. Unlike standard tests that focus on cholesterol, this one looks at how much inflammatory activity is present in your bloodstream. When hsCRP levels are elevated, it can be a sign that your blood vessels are under stress. It does not tell you exactly where the problem is, but it tells you that something is happening that should not be ignored. This is important because inflammation plays a direct role in the development of heart disease. It contributes to the formation of plaque and increases the risk that a plaque can become unstable and rupture. And when a plaque ruptures, it can lead to a heart attack. So even if cholesterol is controlled, if inflammation remains high, the risk is still there. Now here is something many people do not realize. You may not feel any symptoms when inflammation is present. There is often no pain, no warning sign, and nothing obvious that tells you something is wrong. That is why a test like hsCRP can be so valuable. It gives you insight into what is happening beneath the surface. Now let's talk about what affects inflammation. There are several factors that can increase it over time. Diet plays a major role, especially when it includes high amounts of processed foods, sugar, and unhealthy fats. Lack of physical activity can also contribute. So can poor sleep, chronic stress, and certain medical conditions. All of these can create an environment where inflammation becomes persistent. And when that happens, your blood vessels are constantly exposed to low-level damage. Over time, this increases the likelihood of plaque buildup and reduces the stability of existing plaque, which raises the risk of a serious event. Now, understanding this changes the way you look at heart health, because instead of focusing on one number, you begin to see the bigger picture. You start to understand that your body is responding to multiple influences and that those responses can be measured. And this is why tests beyond cholesterol matter. They help you identify risks that would otherwise remain hidden. So the first key takeaway is this: cholesterol tells part of the story, but inflammation tells you something deeper. And if you want a more accurate understanding of your heart health, you need to look at both. In the next part, we're going to explore the second blood test and how it reveals another important piece of the puzzle that many people completely overlook. Now let's move to the second blood test and understand why it reveals something that cholesterol alone cannot show. Because while inflammation tells you about damage and stress inside your blood vessels, there is another factor that plays a major role in heart attack risk. That factor is how your body handles lipoproteins. And this is where many people become confused. Most people are familiar with LDL cholesterol, often called bad cholesterol, and HDL, which is considered good cholesterol. But what many do not realize is that not all LDL is the same. You can have a normal LDL level and still have a higher risk depending on the type and behavior of those particles. This is where the second test becomes important. It is called apolipoprotein B, often referred to as ApoB. This test measures the number of particles that carry cholesterol through your bloodstream. Each of these particles has the potential to enter the walls of your arteries and contribute to plaque formation. So instead of just measuring how much cholesterol is present, ApoB measures how many carriers are moving through your blood. And this difference matters, because plaque buildup is driven more by the number of particles than the total amount of cholesterol. You could have a moderate cholesterol level, but a high number of these particles, and that increases the likelihood of those particles entering the artery walls. Over time, this leads to the gradual buildup of plaque. Now think about this in a simple way. Cholesterol is like the cargo being transported, but ApoB represents the number of vehicles carrying that cargo. Even if each vehicle carries a small amount, having too many vehicles increases traffic and increases the chance of congestion. And in your arteries, that congestion is what leads to narrowing and reduced blood flow. This is why ApoB is considered a more precise indicator of risk in many cases. It gives you a clearer picture of what is actually happening at the level where disease develops. Now here is something important. Just like inflammation, you will not feel anything when ApoB levels are elevated. There are no clear symptoms that warn you early on. The process happens quietly over time. And by the time symptoms appear, significant changes may have already taken place. That is why early detection through testing is so valuable. Now let's talk about what influences ApoB levels. Diet plays a major role, especially diets high in saturated fats and processed foods. Lack of physical activity can also contribute. But there is another factor that is often overlooked. That is insulin resistance. When your body has difficulty managing blood sugar, it can lead to changes in how lipoproteins are produced and processed. This can increase the number of ApoB particles, even if your cholesterol does not seem extremely high. This connection between blood sugar and heart health is something many people underestimate, but it plays a significant role in long-term cardiovascular risk. Now, understanding ApoB changes how you interpret your test results. Instead of focusing only on cholesterol numbers, you begin to look at how many particles are actually contributing to plaque formation. And this gives you a deeper understanding of your risk. Now here is the key point. ApoB does not replace cholesterol testing, but it adds another layer of insight. It helps you see what cholesterol alone might miss. And when combined with inflammation markers like hsCRP, you start to build a much clearer picture of your cardiovascular health. You begin to understand not just how much cholesterol you have, but how it is behaving and how it is affecting your arteries. This is why many experts now consider ApoB one of the most important markers to monitor, because it directly reflects the process that leads to plaque buildup. And plaque buildup is what ultimately leads to heart attacks. So the second key takeaway is this. It is not just the amount of cholesterol that matters, but the number of particles carrying it. And ApoB gives you that information in a way that traditional tests often do not. In the next part, we are going to look at the third blood test and how it reveals another hidden factor that can influence your heart health in ways most people never consider. Now let's move to the third blood test and understand the final piece of the puzzle. Because by now you've seen that heart attack risk is not just about cholesterol. It's about inflammation, and it's about how cholesterol is carried through your bloodstream. But there is one more factor that often goes unnoticed and yet plays a very powerful role in cardiovascular health. That factor is something called lipoprotein A, often written as LPA. This is a type of lipoprotein that is genetically determined, which means it is largely influenced by your genes rather than your daily habits. And this is what makes it so important. Because unlike cholesterol or inflammation, which can change based on lifestyle, LPA levels are something you are born with. Now here is why LPA matters. It is similar to LDL cholesterol, but with an added component that makes it more dangerous. It has a structure that makes it more likely to stick to the walls of your arteries. And once it attaches, it can promote plaque buildup more aggressively. But that's not all. LPA is also linked to increased clotting activity, which means it can contribute not only to plaque formation, but also to the formation of clots. And this combination increases the risk of a sudden blockage, which is what happens during a heart attack. Now here is something many people do not realize. You can have normal cholesterol levels. You can have a healthy lifestyle and still have elevated Lp(a) without knowing it, because this is not something that shows up in standard cholesterol tests. And there are usually no symptoms that indicate it is high, so it often goes undetected unless specifically tested. This is why some people experience heart problems even when everything else appears normal, because this hidden factor was never measured. Now let's talk about why this test is so valuable. Unlike other markers that change over time, Lp(a) typically remains stable throughout your life, so you only need to test it once or a few times to understand your baseline risk. And once you know your level, you can make more informed decisions about your health. Now you might be wondering if this is genetic. Does that mean nothing can be done? Not exactly. While you cannot significantly lower Lp(a) through lifestyle alone, knowing that it is elevated allows you to manage other risk factors more carefully. You can pay closer attention to inflammation. You can monitor ApoB levels. And you can work with your doctor to reduce overall cardiovascular risk. In other words, it gives you awareness, and awareness allows you to take action in areas you can control. Now let's take a step back and look at the full picture. You started with cholesterol, which gives a general idea of lipid levels. Then you looked at hsCRP, which reveals inflammation. Then ApoB, which shows the number of particles contributing to plaque. And now Lp(a), which highlights a genetic factor that can increase risk even further. When you combine all three of these tests, you move from a basic understanding to a much deeper and more accurate view of your heart health. You are no longer relying on a single number. You are looking at multiple layers that together explain what is happening inside your body. And this is what allows for better prevention. Because heart disease does not happen suddenly. It develops over time through a combination of factors. And when you can identify those factors early, you have a much better chance of reducing your risk. So the third key takeaway is this. There are hidden factors like Lp(a) that can influence your heart health regardless of how healthy you think you are. And the only way to uncover them is through the right testing. Now that you understand all three tests, you can begin to see why relying on cholesterol alone is not enough. Because true risk is not defined by a single measurement. It is defined by the complete picture of what is happening inside your body. Now let's bring everything together so you can clearly understand what all of this means for you and what you can actually do with this information. Up to this point, you've learned about 3 important blood tests that go beyond cholesterol. You've seen how inflammation, measured by hsCRP, can silently damage your blood vessels. You've understood how ApoB reflects the number of particles that contribute directly to plaque buildup. And you've learned how lipoprotein A can increase your risk based on genetic factors even if everything else appears normal. Now the question becomes, what do you do with this knowledge? Because information alone does not create change. What matters is how you use it. The first step is awareness. If you have only been relying on cholesterol numbers, it may be time to take a broader look at your heart health. That does not mean ignoring cholesterol. It means adding to it. Because each of these tests reveals a different part of the process that leads to heart disease. When you combine them, you begin to see a much clearer picture. Now, once you have that picture, the next step is to understand your personal risk. If inflammation is elevated, then the focus becomes reducing the factors that are contributing to it. This could include improving diet, reducing processed foods and added sugars, and managing stress more effectively. If ApoB levels are high, then the goal becomes reducing the number of particles that are circulating in your bloodstream. This may involve changes in diet, activity level, and in some cases, medical guidance. If lipoprotein A is elevated, then the approach is slightly different. Since it is largely genetic, the focus shifts to controlling the other factors more carefully. This means being more aware of inflammation and ApoB and taking steps to keep them within a healthy range. Now, here is something important to understand. You do not need to approach all of this at once. Small, consistent changes are often more effective than trying to change everything at the same time. Start with one area that you can improve. Maybe it is adding more whole foods to your meals. Maybe it is becoming more consistent with movement. Or maybe it is improving your sleep and reducing stress. These may seem like simple steps, but over time, they have a powerful effect on your overall health. Now let's talk about monitoring. Once you understand these markers, it becomes easier to track your progress. You are no longer guessing. You have measurable indicators that show how your body is responding. This allows you to make adjustments and see the results over time. It also helps you have more informed conversations with your doctor. Instead of focusing on one number, you can discuss a more complete picture of your cardiovascular health. Now, another important point is prevention. Heart disease does not usually happen suddenly. It develops slowly over years through a combination of factors. This means you often have time to make changes before a serious event occurs. But that window of time is only useful if you know what to look for. And that is where these tests become valuable. They give you early insight into what is happening inside your body before symptoms appear. Now, as you think about your own health, consider this. Have you been focusing on just one number? Or have you been looking at the full picture? Because the more complete your understanding, the better your decisions can be. Now, let me leave you with one final thought. Your health is not defined by a single test result. It is shaped by multiple factors working together over time. And when you understand those factors, you gain the ability to take control in a more meaningful way. You begin to move from reacting to problems to preventing them. And that shift can make all the difference in how you protect your heart and your long-term health.